AGC 2025.
AI app might not be so sensitive as a human, might not be so emotional as a human, might not be so understanding as a human. It only will take the data and generate some results. Definitely, day will come maybe when the app will be much more sensitive, much more like a human, much more understanding. Then we will have issues whether we'll go this side or that side. At this crossroad, what I think is artificial intelligence is being included, and we should not make us like we are behind all this thing. We should have knowledge. Tomorrow, patient might come to me and say, "Doctor, I don't need your pill. Can you suggest me a good app where I can keep myself mentally fit?" Eminent clinician, madam has great experience in clinical treating patients directly. So I would ask Madam Alakananda, Madam, that Madam, do you use any kind of data, any kind of tools, any kind of apps for a patient? You suggest something. I am not saying if a patient is dependent on internet. I am saying for your treatment purpose, for your day-to-day patient care, or you do it in a natural process that of empathy, of human interaction. What do you?
Good morning, and first I'd like to take this opportunity to thank the organizers for inviting me here and keeping such a very important topic because this is very heartening for mental health professionals, especially because for the first time probably because we get the chance to meet a discipline with whom we are pretty far away. Like, we don't understand computer science, and I'm sure most of you find mental health as a very vague and unknown element in your life. And that is how it is entirely portrayed. So as a clinician, very unlike what our senior psychologists were trying to tell us, that she is more interested in dealing with helping people to stay well. We are more, as doctors, people don't come to us when they are well. They only come to us, to our clinics, when they are feeling very, very unwell. So for us, just like any other clinician, though we work in the same pattern like any other doctor, unfortunately, mental and general health is generally divided. Body and mind is a dualistic concept in most of our minds. So the fact that you have included it shows that there is an increasing awareness about mental health, and along with well-being. So well-being is not our concept as doctors. We are like, okay, fine, we know that we would like you to be well, but at the same time we know that illness is something that we cannot avoid. And mental illness at this point of time affects 1 out of 8%. 8 persons in the world has some form of mental illness or other. So why do they come to us for help? They come with problems like they are having difficulty in thinking process, in their functioning, in their emotional aspects, and these are the things that make them suspect that they need psychiatric care. Often we find that many of these people have gone through the internet and made a diagnosis for themselves before they come. And some of their diagnoses are pretty correct. So maybe, as I'm directly answered, Dr. Sarkar, I have personally not used apps with my patients directly. But yes, after 2020, I feel that the opening up of the internet services and allowing teleconsultation to come into practice has actually helped us to reach the homes of each and every patient and improved our psychotherapeutic management of patients. Like, when you need a person to come to you weekly for an hour session, they are not likely to come. But they're sitting at their home, they'll talk to you on the internet. So internet is something that can actually reach out to them. They can never replace us, but they can supplement and complement us to a great extent. Like detection, early detection of psychiatric illnesses can be done, and there has been a lot of data. I was going through, like, as I said, this is a field that is artificial intelligence for me is all related to Google, not beyond that. So for me, this was like, this last 1 month was a lot of studying. And when what I realized is that a lot of work has been done about early detection and diagnosis of psychiatric illnesses, support, prevention, treatment. But whenever I've gone through the articles, the first thought that came to me, and I've tried to go into details, is I don't understand the data manipulation, the representation, and the accessibility aspect that you people understand very well, being experts in computer analytics and digital analysis. But what I understand is the actual core quality data that they are using. The data is not of good quality. So the consistency, comparability, and validity of the data is very questionable in many of the apps that they use. They have used functional MRI data to come to a diagnosis of, say, depression. They have used certain clinical findings on which they had making early diagnosis of schizophrenia. But the point is, it is not just a few symptoms and signs. And recent article I was seeing that was published in Bangladesh, they have used Beck depression inventory for diagnosing depression. That is not a diagnostic tool at all. So if you use, as I was listening to Dr. Dutta when he was speaking about the quality of the data that is put into the machine, that is very questionable. If you use something like BDI, Beck Depression Inventory, as a diagnostic tool, then you really don't know what you're actually finding. So if you're putting garbage in, you are going to get garbage out of artificial intelligence. So it's very important that collaborative work actually take place between researchers, academicians, clinicians, and these actual stakeholders, those who are actually going to avail of this artificial intelligence in mental health care. When it comes to younger generation, they are more savvy with the internet and they are more likely to use it. That's what we find. Like if I ask my patients to do, I'm sure we have many psychologists over here also, so they will agree with me that nowadays when we give them homeworks to maintain mood charting or anything, they will come with apps giving us clear data, like my mood has fluctuated like this, I get graphs and all that. It's pretty nice. And actually, I think that keeps them more likely to continue with monitoring rather than the usual drafts that we used to tell them on paper pencil work that we used to give them, because homeworks is something no one likes. But when it is their own, some app which is actually monitoring their sleep, their entire mood during the day, which they're just reporting on the mobile, they are much more likely to keep that record. So actually this type of applications have really helped us in providing and monitoring treatment to the patient. There are also evidences that you can use such apps to remind them about medications, though that is pretty questionable because even if the reminder goes, people don't care. That is, if they don't want to care, they will not care.
Yes. First of all, a very good morning, and I would like to thank the organizers for welcoming me here. And obviously, as a computer scientist, all I can contribute in this field is through the use of AI and technology for mental health well-being. Basically, my PhD was in a different domain, although computer science, but in a different domain, and then I targeted toward sustainability. And the sustainability goal 3 was good health and well-being, and there in target 3.4, that was predicting that no deaths would occur from non-communicable diseases like mental health. Therefore, I decided to go for this study, and when I was exploring, I saw that a large number, as sir was mentioning, that there was a WhatsApp post, and WhatsApp post as something has given some status, and in the same way, the first data that I got was from social media, from Twitter, from Reddit. If I go through Reddit, we will see that a large number of subreddits are talking about depression. There are subreddits specifically on depression. There are subreddits on suicidal ideation. There are posts on Facebook. There are posts on WhatsApp where people are talking about whether there are mood swings. And obviously, we don't predict them by seeing one single post. Whenever we want to predict, or any AI model is going to predict someone, obviously we are tracking them for over a period of 1 month or over a period of something. And we have came across very disturbing trend. Basically, due to the stigma associated with mental health, most of the people don't approach any professional care. But what they do is people share their emotions, people share their experiences on social media, which is because they are behind some wall and they can have a wall of anonymity between them. And therefore they share their opinions, their feelings without having the option of judgment, because nowadays, till now, people fear mental health judgment because they think that people will judge them. And obviously people pour their heart out on social media. And even Twitter, basically I have worked with social media posts from Twitter, Reddit and Facebook. We have scrapped data from Twitter, from Reddit, There are different subreddits available, there are various different posts, and we have seen that people who are mentally disturbed, I am not saying any specifically clinical terms like disturbed, depression or suicidal ideation. Basically, these are the two domains that I have studied, depression and suicidal ideation. There are posts that people are talking about dying repetitively, not only in text, because I have analyzed their text through a technical natural language processing, and then we have extracted some features. We have done some temporal studies, that is time series analysis of their data, and we have seen that the trend in which the depressive people are talking is very different from which the normal people are talking. There is a trend in which their time series analysis using LSTM models or any deep learning models, we can see that there is a difference in their talking, there is a difference in their tone of speech, there is a difference in the length of their tweets also. The length of their tweets is longer, and the trend of working, they generally post their tweet in the during the time between we have studied from our data that generally between the time between 12 a.m. to 4 a.m. this was the time in which most of the depressive people are posting their data or their suicidal ideation post. Most of the time is like this. Generally, we have extracted some word clouds. Word clouds means I can see that in my corpus what are the words that the depressive people are talking about. We can see that they are talking about hate, life, no enjoyment, like these type of words are coming out repetitively in their word clouds. We have done one study called the topic modeling, in which we have seen if we are extracting the top 5 topics, the same type of words, no enjoyment, no wish to live, this type of words repetitively come out. And obviously we cannot replace professional help, but we can aid them. We at least we can suggest that these people have a give an early warning sign of depression, early warning sign that people generally tend to ignore. We have seen repeated cases where online people have posted something before they have taken some extreme step. So we can obviously inform their caregivers. The last work that I have done is to predict a mental health curve. That is, if I am having data of some person over a period of 1 or 2 months, at least I can give a prediction whether that person will be in what type of mood or whatever their curve will be in the next 2 weeks or next 1 week. And now if there is a dip in the curve, we can inform their caregivers, because generally in the adolescent groups also because I deal with university students, I have seen there is a recent incident that one student, last 1 or 2 months, one student died by suicide. Very unfortunate case, but it's the same thing. He was depressed, and this depression was eminent from his social media post, but depression was eminent from the WhatsApp post that he has sent to his friends. But generally we tend to ignore these messages because people don't tend to approach professional help. That is why AI can only aid. Obviously, we cannot replace the emotional attachment that professional help can have with that therapist can have with the patient. But what we can do is give an early sign, give an early warning to the caregivers, so that at least one person can be saved.
It is about understanding a human. So when we are dealing with human-centered data analysis, so we need to focus on, then only we can enrich the data of AI. That is the process or the way we can collect the data. So we have done, let's see, our studies in our lab. Did it in our University of Calcutta lab. It was done by my colleague Nayanika Shaha, Ananya Sengupta and Moumita. As ma'am said about one psychiatric patient who had post-stroke condition. So these are the clients. He was a practicing doctor. Why I am using this word, practicing doctor, I will discuss on it.
Actually, initially I would like to mention, without directly answering the question of Dr. Sarkar, that is, what do you mean by by well-being, by the term well-being? So here, if you define that is to experience autonomy in our life. So actually, because there is a time constant, better to share some of our experience in order to explain these terms. And suppose this is very, very eminent, very reputed company in India. So where I went there, And there the engineers were saying that, you know, we have many good ideas and we know how to improve the procedures that will increase the quality of the production and it will change the work pattern also. But we do not get that freedom to share. So we are not given that opportunity because of some policy making or whatever we do not know what for. That is, our ideas are not appreciated and encouraged by the management, by the authority. And you think of it, they're very young and very motivated engineers. So what happens? That is the autonomy of is affected. So autonomy gives us means I want to be engaged in my task very, very willfully. I am ready to put effort to reach the goal for which I am engaging, and I want to contribute something. And you know it comes very developmentally within us. That is why we do enjoy autonomy, because you just think of a kid that is whose hands are now free because he is no more crawling, hands are free, and he wants to explore his environment. And he is so enthusiastic that he falls down, he gets up again. If you give something such a spoon in his hand, he throws it. Then he takes it again, throws it further, and unknowingly he learns that is okay, if I do apply greater force, so it covers a greater distance. So this is the enjoyment autonomy, and which is inherent in us, and we as an adult also enjoy when given the autonomy. That has a positive impact on our well-being. And these engineers, they had this mastery, and they wanted to exercise that mastery. So when it is innovated, interfered with, or not so much so encouraged for whatever be the reason, yes, well-being is affected. And it's not enough to have our mastery. We should have a sense of mastery. Many a times what you do find, that is, the students, usually it happens, you know, with good students, that they're very good students, they have the mastery over the subject, they know the paper very well, but because they do not have the mastery over the sense of mastery, they suffer from exam phobia and they do not do well during the examination. So you see how important it is to have the sense of mastery when I know it, and it is perhaps the reason here is the experts in the panel. The topic being the same, there are so many experts in the panel because organizers have decided that is yes, that is each expert should have his or her unique contribution onto the same topic based on their expertise.
As Madam has said, that 1/8 of the global, 1/8 of the population is suffering from mental disorder. You can just imagine, we are having 850 crores of people globally. So what is the dimension of the problem? Now, the negative view of the world is gradually increasing. Negative view of the world is gradually increasing, and political polarization has taken a very gigantic shape. Nowadays, we cannot tolerate each other. Even for a wrong parking, not a very minor reason, we 2, 3, 4, 5 educated people, we go and even try to kill a person, and the man has been killed. This is a report of yesterday. So what I am saying is mental disorder, what we call, or I should say mental well-being, there are two parts. One relates with the inborn problems that has already been discussed in details. We are having a law, Right of Persons with Disabilities Act 2016 in Indian context, and there are 21 different kinds of disabilities are there, of which there are 2-3 areas for mental health. As Madam was mentioning, that one parent of Down syndrome and came to the clinic or like that. Now the other part is this shock-driven mental disorder. Think of, some of your relatives might be there. About 26,000 teachers who are serving in the present context in West Bengal, their service has been, the question has been raised against their appointment and service as a whole, and that is under judicial consideration. Think of the mental state of mind of those who are at the focus. Think of those. So what I am saying is, gradually the context, there are other areas also, gradually the societal context is generating a kind of mental, I should say, shock to the people, which is resulting in the mental disorder or a symptom like that. Very gradually it is increasing.
AGC 2025, where data meets sustainability.